In the meantime, President Obama is saying be brave about health care in a speech accepting the Profiles in Courage Award at the John F. Kennedy Library in Boston. He said it's very, very easy to tear something apart. It's very brave to build it. It's very brave to look out for the interests of those who are very, very poor. But then I started thinking to myself, it happens, is it really that brave to recommend virtually coverage for anything and everything and everyone you want and have the cost of that borne by a few? Is that really brave? And is it risky for those now to, in the face of a media avalanche, to risk tearing the whole thing apart? Aren't they the ones who are braver? Anyway, a former Democratic Ohio State Senator, Capri Cafaro, former Paul Ryan Chief of Staff, David Hoppe. So, David, my view is brave is a definition that has a different interpretation than me versus President Obama. Obviously, it doesn't take much bravery to look at coverage for everyone, pre-existing conditions. We're all in favor of that. But what maybe isn't so brave is the way the costs were borne by relatively few, and ultimately the irony being the higher premiums and the higher health care costs borne by everybody. But that's all I'm saying. That's a very different definition of bravery.
That's true, but if you look at President Obama's own definition of something that's unpopular and you still work for it, there's hardly anything more unpopular right now than the bill that passed the Republican House last week. Having said that, what they're really trying to do is change directions here. The ACA took government control of health care and put it on steroids. The first thing you lost was your doctor. The second thing you lost, you got skyrocketing premiums, you got deductibles you couldn't afford, and now you can't get insurance anywhere in the exchanges because everybody's pulling out. What's happening is the ACA is in its death throes, and something has to replace it, and everybody knows that. What the Republicans are looking to try and do, both in the House and the Senate, is to change over to a doctor-patient relationship, one that's focused on that so that people have access, benefits that their families need, have choices, they have health savings accounts, they can work with their doctor to figure out what works best for them. That's what they're trying to replace the ACA with. ACA was government health care. This is trying to go towards the doctor-patient relationship as the center of health care. That's a tough thing to do, and it's
very tough and very unpopular.
Yeah.
Very unpopular. And Capri, when I look at the way the media is treating these guys as starting death panels again and trying to kill people, and people are going to die as a result of that. I don't remember any of that when they cooked up the Affordable Care Act. That turned out not to be so unaffordable.
There were a lot of people that were, characterizing aspects of the Affordable Care Act, particularly as it pertained to the Medicare portions of the ACA as death panels. But look, when we talk about courage, I think that the real courage here that we need is both from Democrats and Republicans. Yes, the Affordable Care Act is flawed in many ways, particularly in the context of premiums increasing on the individual market and a lack of competition because plans are pulling out. But people do want coverage for pre-existing conditions. The AHCA, the Republican replacement that passed the House, is not necessarily perfect, and I can go on and on into the weeds for that. But what we do need, and I hope that the members of the United States Senate, and they seem to be the adults in the room here, what is courage right now is having a real, frank, bipartisan discussion, not going back and forth about how many white guys are in the room or, who's mad at what or what's going to do in 2018 for the Democrats or Republicans. Let's have the courage to actually sit down and say, what good ideas do we have? How do we make how do we really make a patient-centered model?
But no one admits the flaws in their own plan. Now, you mentioned here that the senators who are taking a closer look at this, Susan Collins, Rob Portman, Lindsey Graham, all moderate senators who have a different view than the House view of this. And you're quite right. But, for example, no one has the truth cornered here. I mean, there's a lot to like about the Republican plans to rein in the cost, but they are still protecting what will be a big government health care program. So I am looking at all of that, David, and thinking, why are Republicans on defense on this when they are still, offering health care through the government?
Partly they're on defense because they've been talking about what they want to get rid of instead of what they want to have a vision of and what they want to give the American people.
I think you're right about that.
That's where we need to go. What will help the people? What would they like to have? A situation in which they and their doctor look for the best opportunities they can have. Now, I think that there is an opening actually, for Democrats to work with Republicans. But some of the Democrats are going to have to agree that you're going to change this from a government-centered system to a doctor-patient relation-centered system. And if you can do that, then I think there's a lot of room to work together. Senator Manchin has said he would like to work together. You've heard that Senator Tester even said he would talk about repeal. There are areas where they can work together, but first you have to start and say, are we going to change this from further government control to doctor-patient relationship control? And if you do that, then I think you can go forward together.
And I think, frankly, again, the AHCA as it currently stands, I don't think actually focuses enough on the doctor-patient relationship where both patients and doctors are making decisions together. If I were a member of the United States Senate, I certainly would suggest, further innovation, pay for performance, value-based
Capri, doesn't that take courage on the part of the former president to admit that, to state that? Almost everyone agrees with what you said on the right and the left. So just a minute. So where's the courage in blaming your opponents for lacking it?
Well, and I think that where the courage lies here, and I think maybe, and I did not hear the direct words out of President Obama's mouth, but I believe that the courage here, the courage that is needed, is to stand up for what's right when it comes to health care. And if you really do want to help people, and this isn't just about statistics, 24 million people losing health care, only 4% of people in the individual market, these are human beings and these are lives. And it takes courage for both Republicans to sit back and say, okay, do we really want to fully repeal or do we want to fix it? And that may be not politically great for them. And for Democrats to come to the table and say, okay, the ACA isn't perfect. We need to work with Republicans to actually fix this for our constituents. It's going to take courage of conviction on both sides to do what's right for the American people. And I implore the members of the United States Senate to actually, get engaged in that real conversation, because there are solutions out there if both sides come to the table.
I guess what I'm coming back to again and again, David, is I don't think it takes much courage to say, we're going to give you more something and you have very little risk of having to pay for it yourself. Where it takes a great deal of courage is to know what you're offering is going to be borne by everybody. In this case, higher premiums whether you have the coverage or not. If he had said that early on, stood by that early on, he'd have every right to be talking about courage. But again, since this was a JFK Profile and Courage Award, it was JFK who famously said success has 1,000 authors, defeat is an orphan. The defeat was the failure of this financially, and that would have made him strong. That would have shown courage had he admitted his failures and appreciating the magnitude of that failure.
You know what else would have been courage, if I may just jump in here, would have been if Republican governors would have actually established state exchanges at the time in 2011, 2012, rather than being too afraid to say they were for the ACA. Had Republican governors actually stepped up and utilized their 10th Amendment power to set up the state exchanges individually rather than defaulting to a federal exchange because it was politically expedient, that would have taken some courage.
A lot of those state exchanges folded.
That's where we differ. Is there a fundamental flaw in the ACA? I think there is a fundamental flaw in the ACA, that it depended upon the government and ever-increasing government control. And in fact, that's not the best way for people to get health care. And so that's the question that we have to ask here. And I think President Obama obviously wanted to make the point that what he did was very courageous. Frankly, he had a very strong Senate. He had 60 votes when they did most of this. The problem was he didn't have 60 votes when they did the final bill, and he had a House that was overwhelmingly in his favor. It didn't take a lot of courage to do that. Having said that, what it will take courage to do is look here, make the changes that must be necessary to change this to a doctor-patient relationship system. I think that does take courage, and I think the Senate and the House will work together to try and do it.
We shall see.